All right, so Shantala, let's talk about the reasons behind the rising diagnoses.
Well, more people are becoming aware that this is not just a disorder that occurs and begins in childhood, that actually can start when someone's young, but that it continues into adulthood. And some people think that once they grow up, it goes away, but a lot of times it doesn't. So more and more people are becoming aware that this diagnosis is something that will continue on for the rest of their lives.
So the boost or the spike, if you will, in the adult ADHD diagnoses, that's not necessarily that the symptoms developed as an adult. They may have already had them, but didn't get diagnosed until they became an adult, right?
Right, not recognized it as ADHD or been treated for something else as a child, and then it became, or they noticed that it actually was ADHD as an adult. Actually, diagnoses always change, and they overlap in symptoms, so sometimes it's hard to tell what the disorder is, whether it's anxiety, depression, or ADHD.
Now, so what are the classic symptoms then?
Well, symptoms obviously are inattention, lack of impulse control, inability to complete tasks, not being able to follow through. So for adults, it can be hard to keep a job. They can do impulsive behaviors that are irresponsible, have trouble with finance, relationships, miss deadlines, and inability to get work done in a timely manner.
Recently, I would say within the last 5 years, I think, we were talking about this. I had interviewed a gentleman in another state who was diagnosed with ADHD as an adult and trying to get through his career. I mean, and juggle career and family life at the same time. Very, very difficult for him.
Right, yes, it definitely impedes daily life and daily functioning because everyone has a little bit of inattention, especially in today's society, but ADHD is definitely impairing someone's daily functioning, their work environment, their social environment, so it really is important to get a correct diagnosis.
So who would tell me if I have it?
Well, a psychiatrist can diagnose ADHD, so a psychiatrist is a professional that is a doctor that prescribes medication. So they're the first person you probably would want to see if you think you may have it. But also, like I said before, making sure you tell them all the other things that are going on in your life, whether it be adjustment, a change, some sort of a trauma, because sometimes symptoms that look like ADHD are actually something else. And vice versa, sometimes people may think they're depressed or anxious, but they actually have the ADHD. So it's really important to get a full psychiatric evaluation and also work with a mental health professional on ways to cope with this.
That's good advice. Now, so let's say I am diagnosed with ADHD. What would be the next step? I mean, would I take a pill? Would take medication for it?
Well, a lot of times medication does help, and there are stimulants that help someone focus and be able to be more successful in society. There's also other behavioral strategies that can go into place to help a person. Obviously, if they know they have this, they probably need to have a clear workspace. They need to free themselves of distractions, maybe take a break from technology or their computer, exercise, eating less sugar. There's a ton of things they can do for themselves and for their body as well as the medication.
Okay, and we hear the term ADD and ADHD.
Yes.
Is there a difference?
Well, ADD is, you would say, inattention, and ADHD would be the hyperactive. But actually, technically, in the books, in the DSM-10, it's just ADHD. But it's either inattentive or hyperactive.
Okay.
Yeah.
All right, interesting. All right, well, good advice, good talk, and I hope, can get through to somebody and they'll go see their mental health counselor, mental health professional to be able to get a diagnosis, a proper diagnosis. Because you don't want, if you in fact do have it, you don't want to ignore it.
Absolutely not. No.
You want to make sure you do get the proper diagnosis and be able to get the help you need.
Yes. It's risen actually in the last 10 years by 43%, the diagnoses in adults, the highest rising diagnosis for adults.
And is it just because, more people are recognizing the symptoms and maybe just ignoring any kind of stigma?
Well, that too. Mental health as a whole, the stigma is going away. So more people are looking for help when they see these things instead of hiding it.
That's a good thing. People need to get the help they need.
Exactly.
And to be able to live the best life possible.
That's very important.
Yeah. Okay. All right, mental health counselor Shantala Boss, always good to see you. Thanks for stopping by.
Thank you.
All right.